Pat. I'm Zeke. I'm going to be your nurse today. Got an order from provider to take out or to put in an indwelling catheter. Could I just get your name and date of birth? Just check that on your wristband there. Alright. Any questions before we get started? No? Alright. So, I'm going to perform hand hygiene. Put on some gloves. And then give Pat some privacy before I expose him here. I'm going to expose you, Pat. First thing I'm going to do is just clean the area. So with that, I'd be grabbing a soapy towel and then just wiping from top to bottom, using a different part of the rag with each wipe. Throwing that away, removing my gloves, performing hand hygiene. And then we are ready to get going on the calf insertion. So, just going to get you into a little better position here for me. Get the kit out here. So, get that out. Going to set my sterile gloves over on my workspace. And then we've got the shiny blue part of our sterile field here. Just going to grab the outside of that and lay it down here. And I'm going to go ahead and put on my sterile gloves, and then I'll finish repositioning that. Nice small gloves. Alright, so straighten that out there a little bit. Throw that. And get my specimen container out, don't need that. I'm going to check the balloon on the catheter just to see that it is inflating. And it is. Take out my iodine swabs. Set those into my container here. And then I would take my lube, spread that out into the container as well. At this point, I'm going to take the plastic off of my catheter here. And I'm just going to set the tip of that into that lube there. Make sure it doesn't touch anything else. Now I'm going to contaminate my non-dominant hand. Just spreading the labia so I can see the urinary meatus. I'm going to take my swabs, come across the sterile field, just wipe the outside, top to bottom. And then again, top to bottom on the inside. And then the last one, top to bottom, right down the middle. I'm going to take the catheter tip now and make sure I get a good 3 to 4 inches of lubricant on it. I'm going to ask Pat to kind of bear down here while I insert the catheter. And again, I go 3 to 4 inches till I see urine, which I do at this point. So I can grab this and go in another inch, and then I'm going to inflate my balloon. Alright, so that's inflated. Just going to pull back a little bit just to make sure it's intact. Ask Pat if he's having any pain. And go ahead and remove my syringe, set that aside. So at this point we are good to go. Everything is in, my sterile field is done. Let me go ahead and throw that, dump my bag out, remove my gloves, perform some hand hygiene. I'm going to go ahead and put on some new clean gloves. And I'm going to attach the tubing to Pat's leg just to make sure there's not any movement or pulling of that, catheter out of the urethra. And I'll attach the bag to the bed here. I'm going to reposition Pat. Get a sheet of paper out of there. Get him comfortable. And make sure he doesn't have any other needs. Go ahead and remove those gloves. Perform hand hygiene again. I would have probably performed pericare there, which I forgot to do, but I could go back and do it now. But I'll move on to the DC of the cath. So, just coming back in, for whatever reason, we're having the cath removed. Hi Pat, could I get your name, date of birth? Check on that, that looks good. Your doctor's DC of the cath, so I'm going to go ahead and remove that. So, I'm going to perform some hand hygiene. Put on some clean gloves. Give Pat some privacy, and I'm just going to expose you here, Pat. Alright, I'm going to go ahead and put down another pad here just to keep them dry. Remove that from his leg, and then I'm going to go ahead and deflate that balloon. Take out some fluid and just spray that into the garbage, and then go ahead and take out the remaining fluid. Alright, so you might feel a little tugging here, Pat, but it should come out pretty easy there. Looks good. Go ahead and take all of that and just throw it away. Remove my gloves. Perform some hand hygiene. Just Just gonna put on some new gloves and perform peri-care one more time on Pat before I finish up here. So again, I would take a washcloth with soap and then just front to back, always using a different section of the washcloth with each straight or swipe. Gonna reposition Pat, get her comfortable, remove my gloves, and perform hand hygiene one more time. That's it.